So I keep finding myself asking you, like, what's going on? And it's because it's so crazy.
Yeah.
It's so crazy. So, you know, I can talk about my experience a little bit. I was treated for Lyme and Bartonella.
Mm-hmm.
And when I was on the drugs in the beginning, especially in the beginning, I literally thought I'll never forget it because I called you like Sunday morning. I waited till 9:30. You're welcome.
Oh, thank you.
Yeah,
Thank you
because
so much.
I didn't want to. I wanted to call you at
Yeah.
1:30 in the morning the night before,
Oh,
but I was,
double thank you.
you know, I know exactly. So amazing.
Yeah.
So I was on day 24 of my. Is it okay if I say the drug? Are you comfortable with me revealing my drug? Okay.
Yeah.
So I was on day 24 of tetracycline. I was taking 1,500 milligrams at this point. I literally thought my head was going to bobble off my body. I was shaking head to toe. I thought I was going to have a seizure. I was going to go to the emergency room. I didn't know what to do. Very fortunately, I have a close friend named Katie McBride Reynolds. Thank you, Katie, for, like, seriously, I'll never, ever stop thanking you for this. Who was awake. She was on the West Coast, and she talked me through my first Herxheimer. I'd never even heard of such a thing. It's so cruel because in addition to already feeling like hell, you get worse when you start these drugs a lot of the time. And so I got in the bath. I took a Xanax. I stayed on the phone for half an hour until I calmed down, and then we decided our plan was I'd go to the ER if I wasn't better in 30 minutes. Mm-hmm. And I was. And then, of course, I called you 9:30 the next morning and take it from there. What happened? What happened
to clarify, I want to make sure that the folks know that I did go over Herxheimer when you were in the office initially, because you said you never heard such a thing.
I never...
Yeah.
Okay, so it's an abstract concept when you're sitting with a doctor for the first time and your brain is on fire and you don't know what's going on.
Right.
It's really like, okay, so you're taking that in as a piece of a giant puzzle of information. So I did know, you did inform me, but I didn't get it. You don't get it till you get it.
Exactly, you don't get it till you get it. And so a Herxheimer, you know, really what it is, I think, is an oversimplification by most people, unfortunately. And you typically hear that it's defined as a die-off from the bacteria, like they're releasing chemicals that are toxins and excitatory chemicals to the immune system, and that's what happens. But some patients on an antibiotic, let's say tetracycline, because there are many doctors who would treat straight through. And there was one doctor in particular who used to treat with tetracycline straight through. And a lot of his patients would come to see me and would have these flares of symptoms that would come on around 7 to 10 days and would kind of just last and go on for months and months and months. So what is that? If it was simply just a die-off reaction, how could it be dying for 5 months? What kind of bacteria takes 5 months and it keeps on dying and dying and dying? So I think that what we think of as a Herxheimer is really a combination of two things. One is actually some of these products are released from bacterial killing, and some of these are actually shed products called Blebbs from a stressed bacteria that's not being killed. And that's kind of one of the reasons that I'm a proponent of pulse therapy, because if you have, let's say, 6 months in a treatment-resistant patient and you get 2 weeks of bacterial killing and the other 5.5 months are just blebbing, the shedding process, I mean, who needs that? You know, it doesn't move you forward and it just flares you up without any real good outcome associated.
What are some of the symptoms of Herxheimers?
So it's usually, you know, an exacerbation of the underlying illness, but sometimes new symptoms can develop. Like, I don't see much these days of acute disseminated Lyme, but I used to when I was younger. I used to see patients who had, you know, erythema migrans, and now...
What is that? Tell people what that is.
Erythema migrans is the rash that happens in some cases of Lyme.
It's what the bullseye rash.
Yeah, so it's a stereotypical presentation of Lyme disease, and it only happens, you know, in a minority in kind of unbiased early studies. So, in the early studies, it happened in like 25% of patients with Lyme, and then unfortunately, it kind of became part of the reporting criteria to the CDC. So some, I think, later studies became skewed because a lot of the patients in those studies had been diagnosed with Lyme because of erythema migrans, and they go back and say, well, X amount of patients with Lyme have erythema migrans, but wait a second, it's part of the diagnostic criteria. So it's like a circular reasoning kind of a thing. So anything that Lyme causes can get worse during a Herxheimer reaction.
What can people do if they're in the middle of a really severe, seemingly never-ending, frightening herx? Like, I've had Neuro-psych herxes that have been mind-blowing. Like, I remember walking down the street. I live in New York City, and I remember walking down Broadway and bumping into a friend of mine, and I was just crying uncontrollably. I couldn't stop crying. I don't think I've ever cried publicly in New York City, and all the many years I lived there. I was so humiliated, and it was like a physiological thing. I couldn't stop, and I was like a complete shell of the person I was. I want to understand, what could I have done in that moment that could calm this down?
I'm really not
Obviously,
sure.
I didn't page you at that point. I should have called you.
I'm really not sure. I don't think there's an easy fix for really bad Herxheimers. When people page me and tell me that their Herxheimers are intolerable, I always say, stop the medicine. That's
Right.
what I usually say. There are some medicines, though, particularly when people have Bartonella, that if you stop too soon, you can kind of stir the pot up, and that's kind of a risk. So the first thing is make sure people are safe. Make sure that if there's Neuro-psych involvement, that they're not, suicidal or would be hurting others. And make sure that people are safe from a cardiovascular standpoint, make sure the blood pressure is okay. I mean, emergency room evaluations are frequent, and they're a lot of times key to making sure everyone's okay. And it could be a colossal, time-consuming event. It could be 6 hours because they don't prioritize you very, high on the list because you're not having a heart attack.
And they don't really understand it, right? I mean, I've talked to so many patients who say, never go to the emergency room because they're going to think you're crazy pants.
It's better to be thought of as crazy pants than to miss something serious. If you have, let's say, a home blood pressure cuff and your vitals are stable, you're not having a high fever, you're not having a rash all over, I mean, chances are things not good should be okay, but you just never know. And it also, if you feel like you're dying, God forbid, I mean, you should get evaluated. Okay. And it's just reasonable and prudent.
Okay.
And, it's, like I said, it's better to have people look at you askance. At least they'll look at you. You need to be evaluated, I think.
Okay. All right.